Have you ever wondered what your blood group means? You may have heard someone say, I am blood group A positive, I am O negative, or I am B positive. But what do those letters and the plus or minus signs actually mean? And why is knowing your blood group so important? Blood grouping is much more than simply knowing whether your blood is A, B, AB, or O. It can be extremely important during blood transfusions, pregnancy, surgery, emergencies, and certain medical procedures. In this video, we will explain blood grouping in simple terms, look at the ABO blood group system, understand the Rhesus or RH system, explain why blood compatibility matters, and discuss situations where blood group differences can become medically important. Let us start with the basics. Blood grouping, also called blood typing, is a laboratory test used to determine which blood group a person belongs to. The classification depends mainly on specific substances called antigens found on the surface of red blood cells. Antigens are like identifying markers. Your red blood cells may have certain markers, while another person's red blood cells may have different ones. Your blood plasma also contains proteins called antibodies that can recognize certain foreign antigens. This is important because the immune system may react when incompatible blood is introduced into the body. The two blood group systems most commonly discussed are the ABO system and the Rhesus or RH system. Together, they give us familiar blood types such as A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, and O negative. The first major system is the ABO blood group system. It divides blood into four main groups: A, B, AB, and O. Let's look at each one. Blood group A. People with blood group A have A antigens on their red blood cells. Their plasma normally contains anti-B antibodies. This means their immune system can recognize B antigens as foreign. Blood group B. People with blood group B have B antigens on their red blood cells. Their plasma normally contains anti-A antibodies. Blood group AB. People with blood group AB have both A and B antigens on their red blood cells. Their plasma normally does not contain anti-A or anti-B antibodies. Blood group O. People with blood group O do not have A or B antigens on their red blood cells. Their plasma normally contains both anti-A and anti-B antibodies. So, in simple terms, the ABO system depends on which A and B markers are present on your red blood cells and which antibodies are present in your plasma. Why does this matter? Imagine that your immune system is programmed to recognize certain blood cell markers as foreign. If incompatible red blood cells are transfused, antibodies in the recipient's blood can attach to the donor red blood cells. This can trigger a potentially dangerous immune reaction. That is why blood transfusion is not simply a matter of choosing blood that looks right. Before transfusion, healthcare professionals carefully check the patient's blood group and the donor blood. Laboratories perform blood typing and compatibility testing, including a process known as cross-matching when appropriate. These checks help reduce the risk of a harmful transfusion reaction. In an emergency, doctors may use blood products according to established emergency transfusion protocols while testing continues. The important message is simple. Now let's talk about the second system commonly included when we describe someone's blood type, the Rhesus or RH system. You may know it as the plus or minus sign. For example, A positive or A negative. The plus or minus generally refers to whether the Rh-D antigen is present on the red blood cells. If the D antigen is present, the person is described as Rh positive. If the D antigen is absent, the person is described as Rh negative. So when someone says they are O positive, that means they belong to blood group O in the ABO system and are Rh positive. Someone who is O negative is group O and Rh negative. This gives us the familiar 8 major combinations: A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, and O negative. But remember, the ABO and Rh systems are not the only blood group systems. There are many other blood group antigens. For routine transfusion purposes, however, ABO and Rh are among the most important systems. The Rh system is especially important during pregnancy. One situation doctors pay attention to is when a pregnant woman is Rh negative and the developing baby is Rh positive. The baby's Rh positive red blood cells may, under certain circumstances, come into contact with the mother's bloodstream. This can cause the mother's immune system to become sensitized and produce antibodies against the Rhd antigen. These antibodies can potentially affect a future Rh positive pregnancy. This is why pregnant women have their blood group and Rh status checked as part of routine antenatal care. If an Rh negative pregnant woman is at risk of becoming sensitized, healthcare professionals may recommend Rh immune globulin, commonly known as anti-D immunoglobulin, according to local clinical guidelines. The timing and circumstances for its use depend on the pregnancy and clinical situation. The important point is that Rh incompatibility is a medical issue that healthcare professionals know how to monitor and manage, so knowing your blood group is particularly valuable during pregnancy. Now, let's discuss some situations where blood grouping becomes particularly important. Number 1. Blood transfusion. Anyone receiving donated blood needs appropriate compatibility testing. An incompatible transfusion can cause a serious reaction. Number 2. Pregnancy. Rh incompatibility can become important when an Rh negative mother is carrying an Rh positive baby. That is why blood group screening is part of antenatal care. Number 3. Surgery. Patients may need blood or blood products during or after certain operations. Knowing the patient's blood group helps the medical team prepare appropriately. Number 4. Severe bleeding and emergencies. People involved in serious accidents or other emergencies may require urgent blood transfusion. Blood banks and hospitals have procedures for managing these situations safely. Number 5. Certain medical conditions. Some patients with conditions that require repeated transfusions may need careful monitoring for antibodies against red blood cell antigens. It is important to understand that having a particular blood group is not automatically a disease or a health problem. The main concern is compatibility when blood or blood products are involved. So, how does a laboratory determine your blood group? Usually, a small blood sample is collected. The laboratory tests the red blood cells using specific reagents, often called antisera. For example, the laboratory may test whether the red blood cells react with anti-A or anti-B reagents. If a particular reaction occurs, it provides information about which antigen is present. The Rhd status can also be tested. The laboratory then interprets the results and reports the blood group. You may sometimes see a reaction described as agglutination. Agglutination means that red blood cells clump together because of a specific antigen-antibody reaction. Laboratory professionals use these reactions as part of the process of identifying the blood group. For transfusion, additional compatibility testing may be performed because safe transfusion involves more than simply knowing someone's ABO and Rh type. Let's clear up a few common misunderstandings. Myth number 1, your blood group determines whether you are healthy or unhealthy. Not necessarily. People with different blood groups can all be healthy. Myth number 2, O negative means your blood can always be given to anyone. O-negative red blood cells are often used as emergency donor red cells when the patient's type is unknown, but transfusion decisions are made by healthcare professionals and compatibility still matters. Myth number 3, AB positive means you can receive absolutely any blood product without restrictions. Not quite. Compatibility depends on the specific blood component and clinical situation. Myth number 4, your blood group can change because of what you eat. Your inherited ABO and Rh blood group does not normally change because of diet. Your blood group is largely determined by genes inherited from your parents. So, why should you know your blood group? It can be useful information for your medical records. It is particularly relevant if you are pregnant, undergoing certain medical procedures, or may need a blood transfusion. However, don't rely on memory alone. If your blood group is needed for medical treatment, healthcare professionals will normally verify it using appropriate laboratory testing. Knowing your blood group is helpful, but proper testing is what keeps transfusions safe. Let's quickly recap. Blood grouping tells us which blood group characteristics are present on your red blood cells. The ABO system classifies blood as A, B, AB, or O. The Rh system, particularly the D antigen, helps classify blood as positive or negative. Blood compatibility is extremely important during transfusion. Rh status can also be important during pregnancy. And although knowing your blood group is useful, healthcare professionals rely on proper laboratory testing and compatibility procedures before transfusion. If this video helped you understand blood grouping, please like this video, subscribe to MedSimpleTv, and turn on the notification bell for more simple explanations about health and medicine.